Hi, my name is Mary and I'm an occupational therapy assistant student at Bryant and Stratton College in Wauwatosa, Wisconsin. Welcome to our interactive upper body exercise program. The population this video is intended for are older adults who are experiencing age-related decreases in upper body strength, which may impact their functional performance and ability to complete everyday tasks. Here are some safety concerns to consider. Before starting any exercise program, discuss with your doctor to make sure that it's appropriate for you to do so. Viewers who have recently undergone a shoulder surgery or injury should especially consult with their doctor to make sure that it is okay for them to do so, as there may be weight or movement restrictions. Viewers with joint conditions such as rheumatoid arthritis should not use resistance when completing exercises. The extra weight puts stress on your joints and can cause further damage or deformity. Viewers with shoulder subluxation do not do these exercises unless you are cleared to do so by your doctor. Prior to starting an exercise program, make sure that you find an appropriate amount of weight so that you don't put strain on your muscles by using too much. Here are some examples of household items that can be used for weight. A can of soup weighs about 1 pound. This is a good starting point to try and find the appropriate weight for you. If you do some of the exercises and find that this is too heavy for you, go ahead and find something that's a little bit lighter. Some examples that you could also use are a water bottle. You could use a full one, but if that's too much, start lower. You could use one that's half full or even lower than that, and as you perform the exercises more and gain more strength, you can gradually fill up the water bottle more. This is what we call grading up the exercise. You could also use weights that you have around the house. For this exercise program today, I will be using 3-pound weights, but I don't recommend that you start there. You want to find the just right fit, which means that you feel the exercise working, you know that your muscles are getting tired, but we don't want to cause discomfort or pain in your muscles. Next, I will talk through good posture. We call this the rule of 90. You want a chair that you can have your feet flat on the floor with your ankles at 90 degrees, your knees at 90 degrees, and your hips at 90 degrees, and your trunk is upright, which means my tummy muscles are tight and my back is tall, just like this. The supplies you'll need for this exercise program are a supportive chair, which allows for that good posture I just discussed. Also, the appropriate weight resistance that works for you. Some of the examples I previously discussed are here. If that is too much weight to begin with, go ahead and start the exercises without any resistance at all. This will allow for proper technique as well as building strength against gravity. As you become more comfortable with the exercises and build up some strength, you can grade up and use more weighted objects, such as a half-filled water bottle. It is also important to have an exercise tracking sheet to know how you're improving. Here's an example of a handwritten exercise tracking sheet. As you can see, along the top is a spot for the date and each of the exercises completed. This is where you will record the number of sets, reps, and the resistance used for each exercise, which allows you to track your progress as you gain more muscle. This is an example of a computer-generated table that can be used to track the number of reps, sets, and weights completed for the exercises. This is a great option if the same reps, sets, and weight is used for every exercise. In addition to the supplies already discussed, a pulse oximeter may also be a beneficial supply to have. This allows you to track your oxygen level and your heart rate and stay within the parameters as designated by a primary care physician. As we are going through this program, I've talked a lot about reps and sets, which some of you may not be familiar with. Reps are the number of times you complete the exercise prior to taking a rest break. The number of sets are the amount of times that you complete each grouping of reps with a rest break in between. For example, if I say 2 sets of 5 reps, that means complete the exercise 5 times, take a rest break, and complete the exercise another 5 times. The rest break is essential so our muscles have time to recover and avoid fatigue or injury. While we're doing the exercises, it's important to make sure that you continue to breathe throughout. A good way to control this is to count your reps out loud and ensure that we are breathing. Before we get started with the strengthening exercises, it's important to do some warm-up stretches and get those shoulder joints ready for movement to prevent soreness and injury. The first stretch, we will pull our right arm across our chest just like this. Using your left arm, you will pull it towards yourself. You should feel this stretch through the shoulder and through your upper arm right here. We will hold this for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go ahead and complete that on the other arm as well. The next warm-up stretch we'll do is to pull our arm behind our head, just like this. Bend your elbow and reach back to touch your back. With your other hand, you'll pull that back towards the back of your head. You should feel the stretch right through here. We'll hold this for 10 as well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go ahead and complete that on both arms. If any of those stretches cause discomfort in your shoulders or your arm muscles, here are some different exercises you can do to warm up those shoulder joints. The first is shoulder rolls forward. Go ahead and do this with both shoulders. Bring them up towards your ear, curve them in a little bit, and drop them back down. We'll do 10 of those. 2, 3, 4, 5, 6, 7, 8, 9, 10. Another shoulder warm-up you can do are some big arm circles. We'll complete 10 of these. 1, 2, 3, 4. As you can see, I'm bringing them up and around in a big circle. 6, 7, 8, 9, 10. Now that our shoulders are warmed up, it's time to move on to the strengthening exercises. When we're doing these, let's shoot to complete 2 sets of 7 reps. If you find that 7 reps are easy, you can increase the reps to 10. If you find that 7 reps is too difficult, decrease the amount of weight that you're using for each exercise. We would like to have a higher number of reps rather than a higher weight. First exercise is shoulder flexion. I'm showing you a side view so that you can see that my feet are flat on the floor with the good posture. My butt is all the way back in the chair and my upper body is upright. To do shoulder flexion, you'll grab around your weight just like this with a fist. If you have something like a water bottle, you'll grab it sideways in a fist like this as well. To start, you'll hold the weight in your right hand and rest it upon your right thigh. Keep your elbows straight and lift your weight all the way up as high as you can. As you're going through this, you want to go nice and slow and resist the pull of gravity. Just like that. That's 1 rep. Don't forget to breathe while you're doing your exercises. I'll show you 7 now. 2, 3, 4, 5, 6, 7. I will complete these the same way on the other side. 1. Start with your weight in your left hand on your left thigh, palm facing down and elbow straight. 5, 6, 7. Go ahead and pause the video now and practice your sets and reps. The next exercise is shoulder abduction. Hold the weight the same way in your hand and grasp around it and hang it off the side of your chair. Your palm should be facing your body. Elbow straight, shoulder straight at your side. Lift it straight up just as we did with the other exercise, as high as you can, and slow on the way back down. That's 1 rep. 2, 3. Keep your wrist in the same position the whole way. Don't twist it forward. 5, 6, 7. Complete the same exercise on the left side. While you're doing these, remember to keep your abdominal muscles tight and not lean your body over to either side. 1, 2, 3, 4, 5, 6, last one, 7. Go ahead and complete those on your own. Next exercise, we will be doing punches straight up into the air. For this one, you want to keep your upper arm straight out from your shoulder at 90 degrees, your elbow at 90 degrees, and your palm facing forward with your weight in a fist here. All you do is punch straight up into the air as high as you can and lower back down. Up. This is 2, 3, 4, 5. Same thing. Control the weight on the way down. 6, 7. Complete the same on the other side. Again, making sure you have that good form. 1, 2, 3, 4, 5, 6, 7. This next exercise are forward punches. This is a great strengthening exercise for things like reaching into the cabinets or the closet or carrying things around the kitchen. To start, you'll hold your weight as close to your chest as possible with your arm at your side and your elbow bent. Straighten your arm all the way out and bring it back in, just like this. Keep the weight up in the air and not sinking down when you punch it out. 5, 6, 7. Same thing on the other side. Extend all the way out and bring it back in. 2, 3, 4, 5, 6, 7. Go ahead and pause the video and complete your reps and sets. We use shoulder rotation in many of our everyday movements. This exercise will strengthen those muscles. Start with your shoulder out to 90 degrees your elbow at 90 degrees, and your palm facing the floor, just like this. Rotate the hand up so it's in the starting position for our upward punches. 2, 3, 4, 5, 6, 7, and go ahead and complete those on the other side the same way. 1, 2, 3, 4, 5, 6, 7. Go ahead and complete your sets and reps. Complete our shoulder strengthening exercises. Once you're done with those, go ahead and do some cool down exercises. The shoulder rolls, as discussed as a warm-up, or any of those other exercises are a good way to kind of cool down your shoulders and prevent soreness or injury. Thank you for watching, and I hope you enjoyed this video on upper body strengthening. Therapists, we would love your feedback on the ease of use and implementation of this video. Please click the link in the description and fill out a short survey. Thank you.